All right, so I'm gonna share some hygiene products that are the same ones that are used in our correctional and penal systems in our nation, that are used in our all mental hospitals in our nation. And do you think that's feasible for any human being? Anyway, so I want to talk about behavioral health in Bellevue Hospital and New York City and all hospitals. And I contacted the owner of Bellevue Hospital and New York City all hospitals today because I called each hospital and I see that the behavioral health centers are still open, and then the inpatient for psychiatric facilities, and they still outsourcing to upstate and other localities to other medical hospitals for prolonged stays of mental health. Which include schizoaffective and depression, anxiety, bipolar 1, bipolar 2. Mariah Carey suffers from bipolar 2. Anyway, adult services, bariatric. It says here we have this whole HIV services. New York City Health and Hospitals Bellevue offers comprehensive mental health services, inpatient, outpatient, emergency. Our renowned programs combine clinical excellence that you be viewed by psychiatrists 30 seconds a day. And they check your blood pressure and your temperature every 6 hours. And what else? And that's about it. Okay, so research. Our mission is to restore patients as vital, healthy participants in their families and communities. Oh, yeah, I was eating. That's how my teeth are decaying too, because I need to go home. Adult inpatient services at New York City Health and Hospitals Bellevue include an 8-patient unit, a 20-bed detoxification unit for patients suffering from substance abuse. I already thought you had a drug and addiction substance program at Bellevue Hospital, so it's a double whammy, for billing. A 20-bed. Why did I never seen someone detoxify in one of those rooms? You need a lot of water, and a lot of staying in the bathroom and the floor to detoxify, not in the bed where you have no freedom to roam around, And when you're ready to eat foods, you start eating until you eat solid foods, even for liquor. Multidisciplinary, and you call your doctor and ask them for bupropion, is it bupropion or something like that, and a lot of cranberry juice, Okay. So multidisciplinary care teams consist of physicians, nurses, social workers, mental health counselors, and activities and therapists. These are people that meet every day in a little room that look like a kindergarten room, and they sit in kindergarten chairs. There's a social worker, there's a pansy, there's a psychiatrist and team, or the 2 psychiatrists that see the attending people. Some of them don't make it. There's a care coordinator and the nurses, and they sit there and they tell you, and they make you come inside one room by one room, and they say how's the treatment been going, and they say, oh, you doing better and everything. I'm the only one that negotiates. When am I coming out? I see you guys on your meds and this and that. But see you guys later. It's the same thing every day, All right. So the next thing we're gonna talk about on psychiatry, is a 20-bed nurses, social workers, and activity. They're individual, and then the people that do programs. I'm going to talk about programs. They say group and medication therapy means that you go pick up your medicine by nurses station in a line every time. If they miss it, they'll go to your room and they say you have to take your medicine, and you have to get up and they take your medicine. Otherwise, if they feel nice, they bring it to you. To your bed. Individualist treatment plans is you don't have no individualist treatment plan. Medication therapy is that. Group therapy is that they sit you in that same table that they had that meeting earlier that day, and they play categories, or they play this little game. I remember they had this little game, a card game. I don't know. And they asked who was the richest man in the world once, and they said Donald J. Trump, and I was like, oh god. They play these little stupid kindergarten games that you play in kindergarten to 4th grade with the kids. Sometimes you get to color, or you get to do a collage. Like it's very good. You get to color. They give you crayons and clear. Sometimes you get to do a little tree thing, and then you add to the tree whatever you want to say. Then you share from your group 1 to 1. That they do that. I don't participate in these, but that's what they do, See patient adult substance abuse. That's about it. And I wanted to share the products. That's all they do there. And there's nurses that come if you flip out on them because you feel like they stupid and they treat you like an idiot, then they put you in a room, in a sound room, like if you're gonna start recording music, and they leave you there. It's very dry. It's a dry room, you know. And I've been there a couple of times, you know. And sometimes they put you in, they strap you up and they straight you up, you know. So I've been strapped 7 times, you know, for not doing anything.